Welcome everyone to the Canadian Diabetes Association's 2016 webinar series. My name is Farah Ismail and I will be your host for today. We are delighted that you're able to join us for a webinar to learn about type 1 diabetes and transitioning into adulthood. Now to start us off, I'd like to draw your attention to our survey. It's located at the top right-hand section of your screen. In order to better serve your needs, we kindly ask that you provide us with your input by completing the short survey towards the end of the presentation, and we thank you in advance for your input. Now, throughout the presentation, you will have the opportunity to ask questions, and this can be done by simply typing in the question and answer box located to the bottom right-hand section of your screen, and our speaker will be happy to answer your questions at the end of the presentation. As well, we will be displaying a few polling questions throughout the presentation and would love for your participation. It is important to note that your answers will remain completely anonymous. Also note that you're able to customize your screens, so you can do this by dragging down the bottom right-hand corner of each of the webinar pods. Our presentation today will last about 40 minutes in length, and we'll have about 10 to 15 minutes at the end for questions. It is important to note that we are recording today's presentation and it will be made available on our Canadian Diabetes Association's website at a later date. So now I'd like to welcome our speaker, Lauren Linklater, and thank her for joining us today. But before turning it over to Lauren, I'd like to give you a brief introduction. Lauren studied at the University of Western Ontario, achieving a Bachelor of Science and specializing in biology, mirroring in psychology. She started attending Camp Huronda with CDA at the age of 8, and she has never left. Providing leadership in all of her roles, she has been volunteering and involved with the CDA from day one of living with diabetes. For more information on Lauren, please read the speaker bio section, and that is located to the left of your screen. So without further ado, I'd like to present to you Lauren.
Well, hello everyone. Thank you for that introduction, Farah. And once again, thank you everyone for joining us, both near and far. Hopefully everyone is able to take away some information after this webinar, and hopefully I can answer any questions that you may have after we are done. So, as we said, this webinar is on type 1 diabetes and transitioning into adulthood. So some of the expected outcomes that I hope for folks to achieve are, first off, I would like to share my story and experiences about living with type 1 diabetes, as that is where a lot of this webinar is pulled from, is my own personal experiences and different things that I've had to deal with throughout my life. Next is to understand the difference between diabetes care in the pediatric and adult healthcare systems. Obviously, there are some differences, and that's what brings us here today. Next, to learn how to better prepare for the transition from pediatric to adult diabetes care. Hopefully, you can pick up some tips and some tricks for whether it be you, some patients you see, or the team that lives with you or close to you that is living with diabetes. Next, to identify ways to become more independent with diabetes management. You are probably going to see that the big theme here from my webinar today is really advocating for that independence and that self-care, because ultimately this young teen or young adult is going to go on and carry on with his or her life and is going to have to become their own advocate in a very independent way. And then finally, explore and understand some of the common challenges faced by youth living with diabetes as they become adults. So before we get started, as Farah talked about, we are going to do a few polling questions. So first, if everyone could answer, how are you affected by diabetes? You can select all that may apply to you, and I'll give you about 5 or so seconds to answer. Great. Thank you, everyone, for those responses. So as you can see, we have a good chunk of people that have a family member or a friend or someone that are living with diabetes, as well as a large majority of healthcare professionals. Great to see you folks. And then a few people that are living with diabetes, both type 1 and type 2. So our next question, how are you participating today? I'll give you once again about 5 seconds to answer that. Great. So the results say mostly individuals are participating. So great to see that. All right. So time to get started now. So I'm going to give you folks a bit of a backstory of myself and kind of what brings me here today. So I was diagnosed in March of 1999 when I was about 6 years old, and it was an uphill battle for myself and my family at this time, as it was about 6 months before I was finally diagnosed. And then I started attending Camp Huronda at the age of 8, pretty much as young as I could start, as both myself and my parents and my healthcare team thought it would be a great opportunity for me to meet some other people that were living with diabetes. Then, after a wonderful summer at Camp Huronda in Huntsville, I started volunteering with the Canadian Diabetes Association at the age of 9. I got really involved with my CDA branch in my local town of Sarnia, Ontario at the time. So I had a lot of great opportunities to do so and kind of continue to branch out more into the community at that time. But obviously, I'm no longer a little girl, and I have grown up, and that's what brings my experiences and my stories here today. So how exactly did I get here? Well, I started working at Camp Huronda in 2008, and that is kind of where I started my camping experience, as well as when I started to have a lot of life experiences that I'm pulling on for this presentation today. I started as a junior counselor in 2008, and as far as I said, I never have left Camp Huronda, and I am now an assistant director there. In 2011, I started working with the Diabetes Hope Foundation, doing things involving their youth day, as well as working at their youth retreats with at-risk youth living with diabetes. Around the same time, in 2010 specifically, I started my post-secondary education at the University of Western Ontario, where I studied both biology and psychology. During this time period, I also was involved with the Western Diabetes Club and different London area diabetes events because I obviously could not get enough. And then finally, over the past few years, I've had the pleasure of attending the transition workshops hosted by the London Pediatric and Adult Diabetes Clinics to talk about programs that are offered by the CDA, as well as the importance of peer supports during this emerging adulthood life stage that we're talking about today. So that's kind of my backstory and the different experiences that I am pulling from. So before we dive into things, I wanted to talk about controlled risk-taking. What is controlled risk-taking? Simply put, it's the chances of loss from various factors that can be reduced or avoided altogether, which I think is a great point to make for young adults transitioning from pediatric to adult diabetes healthcare. Also, understanding that mistakes do in fact create learning opportunities. And once again, there's little to no risk since this is being done in quite a controlled setting. And although one may never know every single detail of the new chapter of life they will start, considering all the possibilities and gathering that information will only help them in that path. There are so many ways to set people up for success in helping to coach them through the transition into adulthood and adult care, which involves opportunities for controlled risk-taking. Allowing the young adult to take on more of their diabetes management care, doing things like filling prescriptions and booking appointments during their last year or two of pediatric care is a perfect example of controlled risk-taking. They're starting to learn the steps that go into the process before being completely alone in their management and their care. It's great opportunities to consult with those peers and those mentors and those medical professionals that you have in your life every single day, so that you're able to get all that information so that you are better informed and can take those steps by yourself. So, emerging adulthood. In the late adolescent / young adulthood stage of one's life, there are often a lot of pressures and challenges that one may be facing for the first time. They're having to make decisions that could impact the rest of their life potentially, like if and where one would like to go to post-secondary school, or what line of work to pursue, if they want to travel, etc. All of this while balancing peers, changing hormones, and added responsibility. Now, that's just a normal teen. Now we can throw in living with type 1 diabetes. It's easy to understand that things can be pretty overwhelming to someone in this situation. Therefore, it's no surprise that during this transition to adult care, many young adults experience significant gaps in treatment or even avoid going at all. Young adults living with type 1 diabetes are at a particularly high risk for non-adherence to diabetes management and loss to follow-up care, as they are at a vulnerable point in their life, and some may find it easier to even avoid this follow-up care entirely rather than face ridicule or even begin to talk about complications with their healthcare team. The timing of transition should occur at a maturational stage of demonstrated effective self-care rather than an arbitrary chronological age. So a lot of people often think just because someone is 18 or 16 that they should be transitioned into the adult care program. However, I have found it very beneficial for someone to understand kind of all the steps that it takes in order to manage your diabetes care on your own before jumping ship into a new healthcare system. During childhood and adolescence, diabetes care gradually shifts from being overseen by parents and guardians towards more self-management and self-advocacy in the adult care system. So, key differences. What brings us here today? What are some of the differences between the pediatric healthcare and the adult healthcare systems? So I just want to be clear that this is a reflection of my own personal experience and as well as some other people I have had the opportunity to chat with. However, every experience is going to be slightly different and unique to each individual as well as the healthcare systems that they are involved with. So even though this is some differences you may see more, you may see less. It all depends. So pediatric diabetes care often involves the family, especially the parents and guardians, in order to be successful. This is because often, but not always, and I want to stress that, young children don't necessarily have the tools in the beginning to master their diabetes management completely on their own. Now, I said I was diagnosed at 6, and although my parents had a huge role in helping my management, I did start doing my own injections shortly after arriving home from the hospital. However, when I got older and even though I was giving my own injections, my parents were still the ones deciding on what I was eating at certain times. So although independence grows over time, parents often have a large role in their child's life. However, in adult care, the focus is more on the individual patient, who ultimately is expected to make his or her own choices about treatment and their adherence behavior to these treatments. Adult patients choose who they want to or do not want to see during their healthcare visits, as they are booked as separate units, rather than seeing the entire team like you may be used to in your pediatric system. Meaning, instead of cycling through multiple team members like I did in my pediatric visits, I now schedule separate appointments to see my dietitian or my endocrinologist or my nurse or so on. Adult patients are largely considered independent consumers of health care, meaning that parents and guardians will not be allowed direct access to medical information or even allowed in the room at visit sometimes, should they be present. As I said, this can be a different time in someone's life where they could be attending a school or going to work in a different city where their parents and guardians may not live. Then there are all the additional tasks associated with the change in visits and healthcare systems related to self-care. Now, this includes things like scheduling follow-up visits, which are often done at least a year out due to the higher demand for adult endocrinologists, as well as ordering and picking up supplies and prescriptions, and scheduling and completing blood work prior to visits. For me, I was able to complete my blood work on site on the day of my appointment for things like my A1C and my pediatric clinic. However, I must now ensure my blood work is completed at least a week in advance in order for the lab to process it and send the results to my healthcare providers in time for my appointments. And finally, self-advocacy. This is the biggest piece of advice I can provide for folks today. As an adult, you're going to be speaking on your behalf, possibly for the first time, and advocating for your health and diabetes care is a huge step towards independence in your diabetes management. So kind of touching on what I just went through and the differences is what I call a shift in dynamics. This image was taken from an article written by Catherine Garvey and authors titled Transition to Adult Care for Youth with Type 1 Diabetes. I think it's a great illustration of how things shift in terms of care and who may be involved in what sense as a patient grows and transitions throughout life. As you see in childhood, a patient is at the center and the focus of the entire family, and they are very involved in this management. However, as that patient slowly gets older and continues into adulthood, the patient becomes a bigger focus, and the family, although they're still supporting, takes more of an external approach. Now, for our next polling question, which will be touched on, or hopefully touched on, and maybe we can answer some more questions after, is have you, your child, or clients ever experienced barriers when transitioning into adulthood? I'll give you about 5 seconds to answer that. Great, thank you so much for your honesty. I would say, based on the results, the majority of folks listening in today have experienced some barriers, so hopefully we can address those at some point in the presentation. So, common barriers. For the first point, there are often a lot of moving points during this stage in a person's life. This is also the age group that is most prone to the loss of follow-up and health risks due to higher risk behavior and management challenges. So if you think there are a lot of challenges that any teen, kind of that 15 to 18-year-old will face. And once again, now we're adding another factor of living with diabetes. There are several competing life priorities. So there are no surprises that young adults often feel overwhelmed and will put their diabetes on the back burner because it's easier to focus on those peer-to-peer interactions than sitting there and analyzing your logbook, if in fact you are even writing down your numbers at this point. Next, sometimes if the differences between pediatric and adult healthcare are not outlined adequately, especially with enough time to kind of explore these differences and how to face them, these differences can add extra anxiety to an already high alert time and situation. It is causing the patient to be stepping way outside of their comfort zone they may have known for years and having to adapt to a different operating system. For me, as I said, being diagnosed at 6 years of age and then not transitioning into adult care until after I was 18 that was a pretty nice comfort zone for me, having 12 years of care under the same team, the same endocrinologist, and people that I cared about and looked up to so much. Now having to find a new team that hopefully treated me the same way and I got the same warm, fuzzy feeling. It can be a lot to handle. Now, for the third point, as cheesy as this may sound, if you fail to plan, you plan to fail. Plain and simple. It's been shown that repetition and any information helps in learning and retention. So there's no difference here in learning about transitioning into adulthood. Avoiding the topic or simply hoping for the best tends to not be the best approach, really in any aspect of life. The more information you can give this young adult, as well as inform their family or their friends or their support system, is only going to help to best set them up for success in taking this next step. For number 4, given the change in life status, as I said, someone who may be going away to school, age of majority, or they could be moving away, it can often cause gaps in financial coverage. Sometimes the emerging adult may not be able to adequately cover the cost of their diabetes supplies and therefore are unable to arrive at appointments with things like a full logbook of numbers because they can't cover the cost of those test strips in order to do so. And because of this, it can deter them from even booking an appointment in the first place because they're so afraid of that judgment and really they're not bringing anything to the table. So they're just going to avoid that at all costs. And finally, emerging adults living with type 1 diabetes pose a unique challenge to both pediatric and adult healthcare systems because this age group and these individuals don't necessarily fit neatly into either of these systems. Rather, they kind of fall outside of the parameters given their needs at this point in life. As you can see, it's probably a lot easier to help manage the diabetes of a very young child versus a teen who may be wanting more control but may not necessarily have the tools just yet. It can add a lot of things. And then with adult care, you may see a lot more older adults or care focused on things like pregnancy, whereas an 18-year-old may not be at that point in their life just yet. So that's why the individual understanding their body and their needs is so very important. It allows them to classify their needs and better advocate for them and themselves during this whole process. So back to the one point I made, you must plan to succeed. So here are some quick tips based on my own experiences and opinion that can help ease in the transition from pediatric to adult care. People often think that transition from pediatric to adult diabetes care occurs at 18 years of age, especially in Ontario, given that it's the age of majority. However, it really depends on the individual and their life and what makes the most sense for them at that point. For me, as I touched on already, I transitioned into adult care after I had turned 18. I'd just chosen to come off my pump prior to my attendance at Western in the upcoming fall. My pediatric endocrinologist at the time and I had a conversation about what seemed best as my new adult endocrinologist, who is still my current endocrinologist, was also located in London. So it wasn't an issue of distance for me. We decided that I should attend one more appointment with my pediatric team prior to officially switching into the adult healthcare system, as there were a few things that we needed to revisit as I had just switched back onto MDI. So this is why open communication between the individual, their healthcare team, and their parents and guardians is so crucial. That life planning that's happening is going to have a big impact. There's so many things happening during this period of a person's life, such as finishing up school, deciding on if they want to continue their schooling, a career, or travel. And as I said, these life path decisions often have a bearing on decisions like when someone will make the transition or where they may transition into a new clinic. And that's why it's important to start the conversation sooner, like at least 1 year in advance. If someone is planning on attending university or college or moving away to work in a different city, they may choose their new adult healthcare system in that city, or they may keep it in their home city and try to work their visits around their visits home. It really depends on the individual. And as I touched on before, it's that gradual responsibility shift. It's so important to start this early so that that young adult can slowly start taking on more of those responsibilities. So, talking about open conversations, I wanted to share a resource from the Type 1 Diabetes Think Tank with you. A good way to start the transition process is by opening up the conversation and putting more responsibility in the team's hands. The Type 1 Diabetes Think Tank Network is constantly looking for ways to improve the lives of those living with diabetes. A big thing that is currently in the works right now is a conversation guide for patients who are starting the process of transitioning into adult care. So I was able to pull this resource from their website, and you can definitely go on there and gather more information and see kind of different things that are up and coming. But here are a set of questions that the team can look at and ask themselves prior to the pediatric appointment in about the last year or so. So those last few key visits. These are the sorts of questions that can help set folks up for success in the adult stage, as it puts things into perspective, as it is the person living with diabetes that is the expert in managing it and organizing their life with it. And I do want to stress that there are no right or wrong answers, and it can really be the young adult that chooses who they want to share these questions with. Maybe it's a great opportunity to have this conversation with just their healthcare team provider while asking mom or dad or their guardian to maybe step outside and really fostering that independence and realizing what their needs are right now and what their needs are going to be in the next year or 2 or 5. So the next thing I wanted to share is a sample plan. So this is just a mock plan that I want to stress that has kind of been put together based on my experience, my conversations that I've had with peers and mentors, as well as additional research that is always available in our very, very readily available internet world. So it kind of sets it out between 1 to 2 years out, and then 6 to 12 months out, and then 3 to 6 months out. So research has been done surrounding youth transitional care dealing with chronic illnesses, such as those living with type 1 diabetes. A lot of this cites that patients find their transitions abrupt and that they may lack information about available resources to them. They also often state that they find it difficult to coordinate all the subspecialties they need to see. So as I said, with that adult care, often you're seeing different members of your team at different times versus seeing your whole team together as you may be used to in that pediatric system. And this is also the reality of things based on my personal experience. The more preparation that's put into place is always great. It's only going to help set those patients up for those potential challenges they may face. So at the first stage, 1 to 2 years out, the big thing is starting to share the responsibilities of diabetes management with the youth. This includes things like making those appointments, asking the questions to the healthcare providers themselves about their management, carrying his or her own health insurance information and their health card and those sort of documents, as well as reviewing blood sugars and trends prior to appointments, refilling prescriptions, or at the very least, starting to understand when and how things should be ordered. During this time period, it's also important for the young person to start having conversations alone with their healthcare team. And I'm not talking about just the nice things like what are the trends you see. It's so important to be discussing those hot topics with the young adult that not only those living with diabetes face, but any young adult will face, such as things like sexual health, smoking, drinking, mental health, and how all of it is related to diabetes. This is a great platform for the individual to take those steps towards self-advocacy. And sometimes it's easier without mom and dad being in the room. Next, at about the 6 to 12 months out mark, there should be an open discussion on the future plans of the individual, where they may be going to school or working, moving away, and so forth, because it's so important to see how this may have an impact on things like insurance and health coverage. For instance, will they still be covered under a parent or guardian plan? Will they be covered under a potential post-secondary institute? Or will they have to seek out a third-party option if that's even available? Also, having more candid conversations about health status at this point is so key, as the individual must understand their body best when moving into a new healthcare system and having to speak in terms of what's best for them. In adult systems, I've found that there often tends to be a large focus on preventative measures for complications, because you're always thinking about what that next step is. If someone is unaware of their family history of things like heart disease, it can make advocacy that much more difficult. Also, having a better understanding of what the patient's next steps in life might be allows for better recommendations for the next healthcare provider if you're taking into things like location. Finally, at about the 3 to 6 months out, the patient will be getting close to their last few visits with their current pediatric team. The individual should have a solid understanding of what his or her prescriptions currently cost and how to go about making insurance claims, if that's even applicable. There's nothing worse than going to the pharmacy for the first time to fill your prescriptions, and if you don't even have insurance, having that realization of how much money it may cost you. So you want to make sure that this person is set up for success. They should also be aware of the differences they may see in their new adult clinic and being open to planning around those potential challenges. So really outlining those differences and maybe seeing, okay, I've been very comfortable in this setting, but this may frighten me, and this is what frightens me about it. What can we do to work together? And something that is common to see in adult diabetes care, especially in larger cities, is more specialized fields of adult endocrinology. Therefore, a patient has certain expectations and knows what sort of management style works best with their diabetes care. They can decide on what doctor may be the best fit for them. I've heard of some adult endocrinologists in cities like Toronto that are super into sports and health medicine surrounding sports, but if you're not an athletic person, that may not be the best fit for you. And understanding that sometimes this can take a while, because for the time being, you're in this partnership for the long haul, so you want to make sure it works best for you too. If the new adult healthcare provider is known, so if you know your new healthcare team that you will be transferring to, the release of medical information should be sorted out in order to smooth out the process when you have your first visit with them. And finally, it is often at this last stage in life, a patient may have been living with diabetes for a significant chunk of time. As I said, I've been living with diabetes for about 12 years when I transitioned. So they may not have taken full responsibility for their management for things like sick day plans. It's always great to kind of revisit those diabetes 101 topics as the individual may be away from home for the first time and maybe handling these situations for the first time on their own. So you want to make sure that they have all the tools and resources possible to even cover what seems like the most basic of things. So hopefully everyone can take a deep breath. I know that was a lot of information on that last slide. So inspiring independence together. As a child grows, there should always be a gradual transfer of diabetes responsibilities from parents or guardians to the individual living with diabetes. Just like any other aspect of life, the more someone problem solves for themselves and troubleshoots different solutions, the more comfortable and confident they are going to get in that area. For me, going to Camp Huronda as a camper and then a staff member, independence was always encouraged and fostered in this environment. I was continuously surrounded by peers and older role models living with diabetes, which provided me with a unique community support system. Also, on top of this, it created a lot of these quote-unquote controlled risk situations in real life that helped an individual kind of gauge their comfort levels while building their learning zones when it comes to diabetes management. So I had the opportunity of doing things like going on a canoe trip for an extended period of time with peers and mentors of mine that were all living with diabetes, and kind of learning what it took on my own to manage my diabetes and different things that need to be taken into account, and having to troubleshoot all while still having a nurse that I can consult with. So the more that you have these life experiences and give them these tools, the better they're going to be set up for, not just with diabetes, but life in general. And finally, overcoming these challenges. Obviously, there's a lot of information that's been covered already. So I wanted to take this opportunity to reflect on a few things before we wrap up. We have identified some challenges or barriers a patient may face during this emerging adult life stage. However, one of the best things we can do is open up the conversation during these transition discussions and identify what some potential barriers may be. After these challenges or barriers have been identified, it's always great to look at the support systems that are currently in place. For me, as I said, a huge support with my peer and social system. I was lucky enough to attend D camps as both a camper and staff member and have created these lifelong friendships and have mentors that I created when I was only 8 years old and continue to look up to this day. And having these individuals who I can not only ask questions, but kind of bounce ideas off of in a non-judgmental way is amazing and is definitely a unique opportunity. But most importantly, I want to touch on these last 3 points here. It is self-advocacy, independence, and support. At the end of the day, it depends on what works best and what makes the most sense for the individual patient. They must be the ones making those decisions for their care, since at the end of the day, they are the ones living with diabetes and they understand their bodies best. After you identify those needs and that person is able to share that with you, whether it be their healthcare team or their parents or their guardians, the support systems can see how they can best step in to support and guide from there, and what resources they can provide in order to fill those gaps and kind of bridge those barriers that may be there. So speaking of supports and resources, there are so many available to us today, as we are so lucky to be able to access the internet. But first, there is the always obvious Canadian Diabetes Association. They do wonderful things outside of hosting these webinars, in my non-biased opinion, of course. But checking out their website for different events that may be happening, such as an expo in your area, or different things online, as they're constantly posting different articles, is always a great resource. As I mentioned, my time with D camps has been invaluable to me, as well as anyone in my family or life if you were to ask them. There are camps operated across the entire country, and there are programs not just for children, but also for families. So I encourage you to check out the website and check that out. Also, I wanted to take a moment to mention the Diabetes Hope Foundation. They offer a guide to successful transition to college and university, which features over 190 schools across the country. It outlines the different services they offer, the insurance options, who you need to register with, different groups or peer supports that they may offer, and so forth. It is an amazing resource, and if the teen you know is even considering post-secondary school in any way, shape, or form, I highly recommend you looking into this guide. It will be able to answer any question, and you can compare the different top choices of schools that you may have. And also, they offer scholarships. So if that is something you are interested in, please look into this further. Also, there is Connected in Motion. Connected in Motion is a diabetes self-management opportunity through peer-based experiential diabetes education, sport, and outdoor adventure for folks 18 years of age and older. So obviously targeting that group that may have just transitioned into adult care and are now looking for what they can do or how they can continue to make those connections in the diabetes community. Finally, your diabetes clinic, both your pediatric and your adult clinic, always offer different events, and it's a great way to see the different resources in your own community. Your local college or university that you may attend. As I said, I was part of the Western Diabetes Association, but from that I was able to not only raise money, but also meet a lot of cool folks and do nice things like come to the Banting House and tour with other folks that were living with diabetes around my age. And finally, your local CDA branch. There are so many different offices located across the country, and they put on additional programs and services that they are always looking to help and guide those living and affected with diabetes. So I encourage you to seek those out if it's anything that they can offer you. And we are now happy to answer any questions that anyone may have. Sorry, folks, just 1 second.
Hi, everyone. Sorry about that. We just had a bit of a dead silence there. But thank you so much, Lauren. That was an absolutely amazing webinar. Thank you for not only sharing your useful tips on how to transition from being a youth to an adult, but really also for sharing your personal experience. So that's very much appreciated. I just wanted to let everyone know at the bottom of your screen there you'll see a resource section. And so we have resources there that the CDA has created. So one of them there is on children in type 1. The next one there is on eating away from home. And the next one there is on knowing the warning signs. So please feel free to download those. They're very helpful and also provide some useful tips along with our presentation today. So as Lauren has mentioned, we now will move on to our question period. So I'm going to take a first question from one of our participants, and they've asked, does having type 1 affect whether I can get my driver's license?
So that is an excellent question. It does not affect in a certain way. You do have to disclose it when you go to get your license, whether it be your G1, your G2, or your G. It is something that they do need to know. And the rule of thumb is 5 to drive. So you should always test your blood sugar before you step into the car. Your blood sugar must be above 5 in order for you to operate a vehicle. I always keep fast-acting sugar as well as kind of a more complex carb like a granola bar in my front seat with me, because if you ever feel low, please pull over to the side of the road test your blood sugar, and if it's low, you must remove your key from the ignition, as if you were to be pulled over, the officer may ask to see your blood glucose tester, and if you are in fact below 5, you can be charged for impaired driving. So hopefully that answers your question.
Great. Thank you so much for that response, Lauren. Our next participant has said, my daughter was diagnosed at the age of 20. I do not like weekends anymore. If she doesn't socialize, I worry, and if she goes out, I worry about eating and drinking with friends. How do I support her with this?
That is an excellent question, and I would say that I think any parent or guardian with a 20-something-year-old probably worries about their child, but peer supports are a wonderful thing. I think just encouraging your child to connect, whether it be within the diabetes community. As I said, there's so many things like Connected in Motion that are out there, but even kind of making sure that you kind of have a plan in place. All of my friends, both living and not living with diabetes, are very aware of kind of what my signs and symptoms are, but I also always have a little bag that I carry with me, so if I'm ever going somewhere or switching purses, I just pick up the bag, which has my glucometer. It has fast-acting sugar, so juice box in it. It has an extra site, extra insulin, and an extra syringe in case my site's not working, as well as glucagon, because it's always good to just be prepared. So just kind of making sure that things can be as easily accessible for your child is the best thing you can do.
Great. Thank you so much for that detailed response. I'll move on to our next question. Actually, a few participants have asked, what are the factors that made you want to go back to MDI over the pump?
That is an excellent question. So I chose to come off my pump because, full disclosure, I wasn't being overly responsible on my pump. My management wasn't where I wanted it to be. I found that I was being just more or less lazy. I was giving myself a bolus without fully calculating my carbohydrates and testing my blood sugar, not because I didn't know how to count carbs, but because I didn't want to. So I thought if I went back to the basics and having to physically draw up the insulin on my pen, I was going to have to be a lot more aware of what I was doing. So I kind of had that conversation with some of my peers, and I thought it was the right choice before moving away and going to school. So wanted to put the ball back in my court.
Great. Thanks again for sharing that personal experience, Lauren. Our next participant has said, I'm 15 years old and I'm interested in getting a tattoo. Is there any caution around tattoos and potential complications related to diabetes? Do you have any suggestions?
Also, another great question. So my word of advice, although I do not myself have any tattoos, I do have lots of friends that do. Just with any tattoo, you want to make sure that you are keeping it clean. The risk of infection for those living with type 1 diabetes is that much higher. So you want to make sure that you are always following those steps to keep everything clean and however the proper tattoo protocol is, as well as you never want to give an injection through a tattoo. So maybe if you often use your arms for injections, it might be good to plan out in advance, like maybe a different location for that. But other than that, just make sure that you are safe and keeping it clean.
Great. Thank you so much for that response. Our next participant is wondering if people living with type 1 are given any priority for on-campus residence at college or university. And if so, are you aware of how they can access such a priority list?
Yeah, so every school is different, I will say that. But I do know folks who have been given an individual room or a room on a first floor because that's what makes sense. But every school has a different service that you register with. when you are looking into university or colleges. So most often it is the disability services that you can access. And for me, I just lived with a friend of mine in high school, but it is something that is available, and I do know of people who have had priority placement because they are living with diabetes.
Great, thank you so much for that. Our next participant has said, my patient often travels within Canada as he is part of a sports team and finds it hard managing type 1 well, given all the time changes he deals with. Are there any tools he could use or any tips that you could recommend for him to manage well?
Yeah, that's a great question. Traveling within Canada is definitely a lot easier, I would say, given that we have adequate healthcare across the country for the most part. But I would say having those conversations with the healthcare team. I know this question is coming from a healthcare provider, but looking at switching the time if they are on a pump, like when is the best time to do that, if it's a transition that happens in a time shift before this individual flies out, or if it happens after the fact and slowly adjusting their insulin. It's all up for debate. Every person is different, but I would unfortunately leave it up to the medical professionals for this one.
Great, thank you for that honest response. Our next participant has said that he's often up late studying and he finds it hard to stay awake. A lot of his friends are also using things such as energy drinks, but he knows they contain a lot of sugar. Do you have any other suggestions on how he can stay up late so that he can study for his exams?
Yes, it's great that you are aware that energy drinks can have adverse effects. For me, when I was in university, I wasn't much of a night hawk. I would pretty much study to 11, then wake up at 6. But for me, I always found that keeping my blood sugars as in control as possible. I know stress and during exam periods can make my blood sugars run high and therefore cause me to be tired. So making sure that's being as level as possible or as much as you can manage, as well as keeping hydrated. A lot of people want to cram in as much coffee or tea as possible, but making sure you're having enough water and exercise. I find that when I exercise, all my endorphins are kind of up, obviously, and I'm able to study with more of a clear head and also get a better night's sleep when I finally call it quits for the night.
Great. Thank you so much for that response. I see quite a few questions coming in, folks, and we're getting close towards the end of the hour. So we'll do our best. We'll probably take about 1 or 2 more questions here, and then we'll wrap it up for today. But for the questions that we didn't get to, please email us at webinars@diabetes.ca, and our CDA staff will be happy to respond. So Lauren, our next participant has said, when a young adult goes off to college or university, the care can be so fragmented. What did you find was the best way to stay connected to your healthcare professionals?
As I said, both my pediatric and my adult healthcare teams were located in the same city, but I had a conversation with my pediatric team, specifically my endocrinologist, about what kind of management style works best for me. So how I am managed in my adult care team is very similar to how I was managed in my pediatric team. So similar style, just different delivery system, a different person. So that way it seems pretty seamless to me, as not too much changed. I just look at it as a different person who is seeing me at that point.
Great, thanks for that, Lauren. For our last question here, our participant has asked, should my team disclose that she is living with type 1 diabetes with her employer?
Well, just like anything, you cannot be turned away because you are living with type 1 diabetes. That is discrimination. I have always been open and honest, and for me, it's pretty hard for someone to miss that I'm living with type 1 diabetes, given my work experience and how open I am. I have always found that honesty is the best policy. I'll relate it to when I was in university. Since I was in a lot of science labs where I was unable to bring food into the lab, it was always great that my teaching assistants or my professor already had an understanding of kind of what I was dealing with, so that if I just gave them the signal, it was like, yep, just go grab your food, because otherwise it may have made things a little harder. So I can say that a lot of people have struggled in things like university and college when they haven't been upfront, but I do wish you the best of luck with your employer.
Great. Thank you so much, Lauren. And that concludes our webinar for today. I'd sincerely like to thank Lauren for speaking on behalf of the Canadian Diabetes Association. It has been a great learning experience. I do want to remind everyone that our webinar was recorded today and will be made available on our CDA website in the coming weeks. Another reminder to everyone that upcoming Type 1 webinars, we still have one coming up on May the 24th on diabetes burnout, and that'll be presented by Crystal Johnson. And again, our last one for our Type 1 series on June the 1st on diabetes technology and new devices. So we definitely look forward to your participation for those. As Lauren has mentioned already, CDA offers many camps and for youth and families of youth living with diabetes. So we do have 12 summer camps and 11 family camp programs to help children, youth, and families get the support they need to live well with diabetes. So I know Lauren had mentioned it earlier on her resource slide. So again, just a reminder, for more information and to register, visit us at dcamps.ca. And lastly, for those of you who are looking for more support and resources for living well with diabetes, please feel free to call our toll-free line at 1-800-BANTING. So that's 1-800-226-8464. We thank you for joining us today, and we hope you've enjoyed learning with the CDA, and we look forward to your participation in the future. Thank you.